Hello everybody. Today we're going to talk a little bit about Part 3. So Christy, just as a sort of brief overview for everybody, in Part 1 we would just talk the basics about the hormones, prescribe, monitor, adjust, kind of just to get everybody going. In Part 2, kind of heavy focus on breast cancer, start introducing PCOS, a little bit more complex case studies. Is there more that we're going to talk about at Part 3?
There is. I think you could go on forever about all the cases and disease states that hormones helps. In Part 3, they go into extensive detail about chronic fatigue and fibromyalgia and all the things that hormones can help with on that. Long haul COVID, which is on everybody's mind right now. What do you do with those patients and how do hormones help? There are treatments and protocols that are evidence-based and tried and true with great results for you and your patients.
That's great. What about things like, does he go into any more detail on PCOS? I know we just started to touch on it at Part 2, but what does he do in Part 3 that's different?
Yeah, Part 3, he goes extensively into PCOS, and everybody thinks they know and understand PCOS, but they don't until they attend the WorldLink course. PCOS is such a complicated disease state that if we don't treat it right at the beginning or right when we find it, there's